Hey everybody. So this video today is about the basic treatment options that our patients have for comprehensive or full treatment. You know, when you're looking to have your teeth corrected as much as possible as far as alignment and your bite, your what we call your occlusion, whether it's spacing, crowding, overbite, you know, these types of things. So we're not focusing so much on how we do that, but there are different appliances or different tools that we as orthodontists will use to correct whatever issues you might have with your teeth. So let's start with the first one right here. And when people talk about braces, this is usually what you think of. These are traditional braces. They're made of stainless steel, all right? Most kids will still get these. This is still the most common and most traditional way to have orthodontic care. And as you know, most children will like to pick colors to put on their braces, from visit to visit to kind of coordinate and have a little bit of fun with them. But one of the benefits of braces over some of the other options we have is that, they're glued to your teeth. So with children, they're gonna work as long as the braces are glued to their teeth, which is what our job is, to put them on and to plan how to use them properly and then put them on properly. So typical average case typically lasts about 18 months or so, and that goes really with most of our treatment if you're looking at a typical average full treatment case. But again, most common, you do have to be careful with certain foods you eat, and chewing gum and sticky candy and things of that nature, simply because the braces can loosen. They're pretty durable, but if you take care of them, it's rare you'll have an issue, but you do have to be careful with certain things with your diet. Okay. Now, just as effective and the same exact thing that we're talking about with regular braces, they're also ceramic braces. All right. So ceramic meaning that they're made of porcelain. Okay. So what that means is that instead of made of stainless steel or metal, the braces themselves are made of porcelain or ceramic material. All right. The difference is obviously aesthetics. Okay. For a patient who still needs or wants to have traditional braces, you can choose a more aesthetic option for older teenagers or even adults, because they're just not as noticeable, especially from a speaking distance. All right. It's not invisible. You still see a wire. However, not as obvious as something like this. Okay. So that's another option. Pros and cons are the same as this. Okay. However, we're just talking about an increase in aesthetics, but yet they feel the same. They work the same. Everything else is identical. Okay. So we put these two out of the way for a minute. Okay. And then we talk about clear aligners, or what we call in our office clear aligner treatment or clear aligner therapy. All right. The brand name that made this popular was Invisalign. Okay. There are a number of companies out there. We typically use 2 or 3 of them. And we will kind of pick which company we think will work with your case the best, as they will vary and they all have their pros and cons, and the plastics are a little bit different, and some of their strengths and weaknesses vary slightly. This model is for Clarity 3M aligners, which is these are the ones we're using on most cases these days. So the idea is simple. Okay. We can do many of the same treatments that we can do with traditional braces now with clear aligners. All right. The benefit, number one, is obvious. The primary reason people get these is for the aesthetics, because even when compared with ceramic braces, all right, much less noticeable. Okay. However, you don't want to be misled, because sometimes if we look at another model of these, most cases are going to have a number of attachments. So if you look here, all right, if we take this tray off, okay, you will see on the tooth, there's a bump there. All right, there's another one on this tooth right here. Okay, so we will place a number of tooth color attachments. It's used by the same glue that we use to put your braces on with, or that the dentist uses for a tooth color filling. And we put them strategically in a number of areas to help the trays not only grip tighter in those areas, but really to put pressure to give the trays a better grip to the teeth, so they can actually move them certain ways or other ways. Without the attachments, the aligners are not nearly as effective. They're very limited, and you really can't do most of the treatments without them. Okay, so they are simply removed when the aligners are done, when the treatment is complete. But it's not as clear as you think sometimes, because it's not just the trays. You will have some attachments on your teeth, and they can be numerous. Sometimes they do need to be on the front teeth. We can't usually allow patients to pick and choose where they will or won't be. So it's a necessary part of treatment. Still more aesthetic than ceramic braces, however. All right, but not totally invisible. All right, these are to be worn all day, every day. Recommendation is about 22 hours a day. You're only taking them out to eat or brush. If you don't do that, they're not going to work. Okay, we typically have patients change these out weekly. So each tray is a stage, And what we do is on our software, whichever company we're working with, we have access to this software, and we will plan every movement of every tooth, okay, to get you from point A to point B, which is the finish line. Right. So one of the misconceptions is that whether it's Invisalign or 3M, that these companies treat your cases. They are simply 3D printing labs that with great software that gives us access to this software for us as the doctors, as the orthodontists, to plan your case. So no two doctors will really plan any case alike. So we're basically virtually planning your case before we ever put your aligners in your mouth. Okay. Which is why the company doesn't really make that much difference, other than the small nuances, like I said, and we kind of know which ones will work better for certain patients and certain treatments. Okay. So again, treatment time is going to be roughly the same. Neither one of these is really faster or slower. Okay. But if you're going to do clear aligners, you have to be the type of patient, okay, who can really commit to wearing these full time. It's not for everybody. If you're not the type of person who can wear something full time and commit to the time commitment and the effort it takes to take these out when you're eating, to clean them, to put them back in religiously, then clear aligners are not for you. If you are, you'll be really happy with how this works and the results that it can get you. Okay, so the last option I want to show is one of our newest options, which we've been offering for a few years now, and these are lingual braces. All right, the brand we use is called Embrace. Okay, it's the newest lingual company out there, and one of the things about lingual braces, not a lot of orthodontists offer them. Myself, in our practice, we didn't offer them until a few years ago, and honestly, we just didn't. There wasn't a system that we felt comfortable enough with for patient comfort, but also for predictability. And honestly, ease of use, ease for the patient, ease for the doctor. If treatment is harder to work in someone's mouth, if it's harder to treat someone in their mouth, it's more uncomfortable for the patient, and sometimes treatment can take longer too. And we find this system to be very efficient. So if you look closely, okay, obviously the brace on the backside of the teeth, this is the most aesthetic way to get treatment. Now, we cannot do everything that we can do with traditional braces or even with clear aligners at this point, okay? We can treat a lot of cases with the lingual embrace, okay? However, we cannot correct big overbites, overjets, cases where teeth need to be extracted. We can do a lot of things more and more as the months go by, but it's still somewhat limited, okay? A lot of our patients are candidates for this though. A lot of patients are coming asking for aligners. They don't realize we have this option, okay? And then once they realize we can do this, hey, maybe I don't want to wear those trays all the time anymore. So it does become another option that we can offer our patients for really aesthetic treatment because there are no attachments, okay? So if you look closely at the system itself, okay, one of the nice things is you see how that wire loops up and down, right? Zigzags, right? You can floss between your teeth very easily. There's nothing, the wire's not going to get caught because it's bent out of the way. Now, one of the similarities between lingual braces and clear aligners is that this is what we call digital orthodontics. Both these systems, okay, we plan virtually on the computer screen, which means we have similar software that we can actually take all your teeth, move them on the screen, plan every movement that's going to happen before we ever treat your case, okay? And these wires, unlike what we use for traditional braces, which are stock wires, which we will custom form here and there, these are 3D generated. They're actually bent by a robot, which is pretty cool, with all the movements of all the final results of your final positions of your teeth built into these wires, okay? So sometimes we can see patients less often when we put these braces on, when we're using this system, okay? Because it doesn't need to be activated or tightened as often, okay? So benefit obviously is the highest level of aesthetics during treatment, okay? You will have some speech issues in the beginning, all right? Younger people tend to adapt to this better. Older individuals, middle-aged adults, they get used to it. Takes a little bit longer. It can take anywhere from a week to a month and a half, depending on the patient. We'll discuss with you if we think you're a good candidate for it. But it's definitely an option for a lot of patients these days. Something we're very excited about. And for the last few years, we've been getting great results with this for the patients who it's appropriate for. Okay. So as you can see, we have a wide range of treatment options these days. All right. All different pros and cons for all of them. Okay. But the best way to really find out what's best for you, you come in for a free consultation, all right, at our office, which we always offer, and we'll go through for your case what the pros and cons are, and what we feel might be best for your situation, and kind of advise you. But in a lot of times, the choice will be yours. You just have to know going in, the good and the bad about the systems, and what fits not only your case, but also your personality and your lifestyle the best. All right. Hope you guys enjoyed the video, and we'll see you again next time.